Welcome to the University of Calgary Faculty of Nursing Information Night. My name is Emma, and I'll introduce myself in a minute. So to start off with, we're going to go through some introductions and housekeeping. I guess we don't have cameras, so just keep your microphones off, just so we don't have sound and feedback. We'll ask you to save your questions till the end because we might cover your question before we get to the end of the presentation. And you can put your questions in the chat, and we will answer them at the end. So we'll do the land acknowledgement, talk about an overview of the BSCN program, what it covers, what the difference between the BN and the BSCN are, some of our other routes, and why nursing at UCalgary, and then we'll have time for some questions at the end. So I will get our presenters to introduce themselves. Dave, if you want to get started.
Sure. Hi, everybody. My name is Dave Patterson. I'm the Interim Associate Dean for Undergrad Practice Education and an Assistant Professor of Teaching here within the faculty.
Hi, I'm Carrie McKay, and I'm the Director of Faculty Operations. It's nice to meet everyone.
Hi, my name is Camille Antioquia. I'm from the undergraduate student recruitment team, and I'm just here to assist with mostly any applications or admissions related questions.
And my name is Emma Lockyer. I am a Senior Program Specialist in the Undergraduate and Graduate Programs Office in the Faculty of Nursing. So I'll start us off with a land acknowledgement. The University of Calgary, located in the heart of Southern Alberta, both acknowledges and pays tribute to the traditional territories of the people of Treaty 7, which include the Blackfoot Confederacy, comprised of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including Chiniki, Bearspaw, and Goodstoney First Nations. The City of Calgary is also home to the Métis Nation of Alberta, Districts 5 and 6. So with that, we're going to launch into the why UCalgary Nursing. So here's just a few things that the UCalgary Nursing program has to offer. You get over 1,600 hours of practice learning with integrated curriculum into both theory and practice, and lots of small groups, hands-on learning, access to faculty members and collaboration. Dave, do you want to speak to some of these a little bit more?
Sure. One of the things that we are able to offer is the hands-on simulation learning. And we're going to talk a little bit more about that and watch a video of the sim lab in a minute. We limit the practice groups to groups of 8. So we've got one instructor with 8 students in practice, which is nice because it adds that little bit more of a personal relationship between yourself and the faculty member. And we also work very closely with other faculties and units on campus, working with some interprofessional educational opportunities. And as you see on the screen, it talks about medicine, social work, kinesiology. We've also started recently working with the faculty of veterinary medicine, and working with some of the One Health opportunities that are here on campus. So.
All right. Right. So what do you study in nursing? So the undergraduate nursing program is spread across, so it is a 3.5-year program, which we'll get into a little bit more in a second here, but it's divided into kind of three levels almost, I guess you could say. So you come in with an introduction, foundations, and then complexity, integration, and consolidation. So what does that mean exactly? So it's a 3.25 to 3.5-year program, ending either the spring or the fall. So it's a condensed program. It's still the exact same number of credits or units as any other bachelor's degree would be. It's 120 units. It's just delivered in a compressed time frame. So you go through the spring, as you can see here, for years 1, 2, and then year 3, you either have your final placement in the spring or the fall, which is what makes it that 3.25 to 3.5, just depending on when you do that last placement. Year 1 is all foundational courses, including some courses within the Faculty of Nursing. And then clinical placements start right at the beginning of year 2, and through the beginning of year 2 and on, you will have clinical every single semester. The Bachelor of Science in Nursing is a generalist degree. So there's no majors, there's no minors, and there's no specializations. That's pretty much the standard for nursing education in Canada. Students graduate from this program qualified to work in all areas of healthcare, and then are able to enter into areas of interest to them from there and take on specialized training post-graduation. So you can kind of see how the program progression is broken down here. So what does year 1 look like? So first year of the program, students complete 33 units of coursework. So that's 11 courses by the end of the summer of their first year in order to move on to year 2. So as we mentioned, year 1 is the foundational year. So you're taking anatomy and physiology, academic writing, introduction to nursing, Indigenous health studies, statistics, and some option courses that are going to build that really strong foundation for you going into clinical and nursing theory. Year 1's your only chance to take option courses within the whole BSCN program. Years 2 and onward are absolutely nothing but nursing courses. So it's your chance to kind of explore some topics outside of nursing. And most nursing students do take a full course load of 5 courses in each of the fall and winter terms, and then the final course in the spring in order to fit everything in. And I will let Dave speak about year 2.
One of the nice things about year 2 is that we're bringing you right into clinical practice. There are some foundational classes that help to increase the knowledge level that you've got when you come into the hospital or into the care facilities. You'll see that there's a microbiology and biochem offering, as well as foundations of relationship that we talk about. In foundations of relationship, we're talking about how to interact with others, with our clients, with our patients, with family members, everybody that we deal with, including other healthcare practitioners. In the first semester, or the fall semester of term 3, you see that we have a care of aging adult and care in the community, which are both 1.5 units long, and that's because they are 6-week courses. So everybody does both care of the aging adult and care in the community theory times. Half the group will be in care of the aging adult, the other half will be in community, and then that will flip at the 6 or 7 week mark. And there are practicums that are related to those theory courses. And that will include lab days and time in clinical, just to make sure that you've got some hands-on time to practice safely in the labs, and then be able to interact with actual patients when we get into the clinical portion of the practicums. When we move into the winter term, so starting in January of the year, so term 4, we bring in some complexity. And complexity with pathophysiology and pharmacology are really working in acute care nursing. And that acute care nursing is hospital-based nursing for the most part. And you'll see that this is called Practicum 1. You will see another one in the 3rd year, where we talk about some more additional acute care things. By having specific classes in pathophysiology and pharmacology in the 2nd and 3rd years, we have the ability to get into a little bit more depth than a concept-based program may allow, which is nice because then there's a more focused ability to talk about the way the pharmacology or the drugs interact with the person and our patients. Moving into the spring semester that term, there is evidence-informed nursing and another shorter version of a pharmacology class, another 6-week version there, and then a final consolidated practicum in that term, which gets you into the hospital a little bit more frequently than you are in the winter term, helping you to consolidate all the learning from 2nd year at one time.
We won't go into third year right now because that's a little bit further out, but just that gives you an idea of kind of what the beginning of the nursing program looks like and how you move from that foundation into your practice years. So some of you might be thinking, what's the difference between a Bachelor of Science in Nursing and a Bachelor of Nursing? You know, you might have heard that the University of Calgary had a Bachelor of Nursing program, which we did up until this past year. So we have introduced a BSCN, a Bachelor of Science in Nursing, which is what this program is. Our first cohort was admitted to this program for fall 2024, so they are in first year right now. Fundamentally, both degree types prepare students to enter practice as a registered nurse. Both programs prepare students for registration with CRNA, the College of Registered Nurses of Alberta, to write the NCLEX exam and become an RN. There is no different in employment opportunities in Alberta or beyond Alberta. In fact, within Alberta, we have had both BN and BSCN programs offered for quite a long time. MRU offers a BN, University of Lethbridge offers a BN, but MacEwan and the University of Alberta both offer BSCNs. So we've always had nurses with both practicing and training here in Alberta. It's common practice for nursing programs to update their curriculum every 10 to 15 years. And the BN program that we're wrapping up launched in 2010. So we're right within the right time frame to be revising our curriculum. You know, a lot has changed in science, in healthcare. We've had a pandemic, among other things. So it's just time for a refresh. The new program was developed based on student, faculty, and stakeholder feedback. That feedback included feedback from our practice partners, such as Alberta Health Services, as well as from students about wanting to get into practice faster. And based on that feedback, that's why we went to the 3.25 to 3.5 year condensed model, was to allow students to enter that practice faster. And the change in name, the change from the Bachelor of Nursing to the Bachelor of Science in Nursing, distinguishes the change in program, but it also follows a national and international trend in degree nomenclature. So we're just kind of aligning with what the standard for nursing degrees across North America and the world is becoming. BSCN programs do typically have a little bit more science content in them, which Dave kind of touched on talking about year 2, where you do have those pharmacology, those physiology, all of those things integrated in just a little bit more. And sorry, I've got 2 screens going here. You may have also heard that not only does the University of Calgary have programs at our main campus in Calgary, but we have our rural and Indigenous community roots. So these programs are designed to allow students to earn a nursing degree without leaving their home community. So we have several program sites. Right now, we have our rural community route offered at Drayton Valley, Wainwright, and Bonnyville, and our Indigenous community route offered on the Siksika Nation, the Tsuut'ina Nation, and at Bonnyville as well. These are delivered using a blended model of online and in-person learning, with labs delivered in their communities and clinical placements within those rural service areas. So if you are from an area near one of those communities and are interested maybe in staying in your community instead of relocating to Calgary, you might want to look into one of these programs instead. If you're interested in working rurally as well. You do have to meet the residency requirements at the time of application and for the duration of the program. So you do need to already reside there in order to apply. As well, we also have a collaborative Bachelor of Science in Nursing program with Medicine Hat College, which we've offered for many, many years, serving students from southwestern or southeastern Alberta and southwestern Saskatchewan primarily. And with that, we're going to move into a little more about some of the other things we offer. So we do have our Clinical Simulation Learning Center, which, let's see if I can get this video.
Sure. The Clinical Simulation Learning Center is located on the main floor of the Faculty of Nursing, Professional Faculties Building. It has about 30 some different options to set up the lab space. And this is the building itself that you see on the screen right now. And we're just gonna hit play again. And you want to see what happens if you do that? Oh, okay. So what you're seeing on the screen is part hands-on training with different types of mannequins. We have mannequins where we can start IVs, we can do CPR certifications and training with feedback that tells you whether you're doing proper CPR. We also get to look at how to actually do different forms of assessments on the mannequins, which allows you as a student to actually work with the style of assessment that you're going to be doing in a safe manner. We have folks that are trained in all sorts of different specialties. Even though we don't train you into working into specialties, we graduate generalist nurses. We do have specialists that are on faculty that have worked in a number of the areas that we're showing. And right here, we're looking at Lucina giving birth. Lucina can give birth every about 12 minutes. So she can get very busy. There it is, 32 care environments with 3 actual high fidelity simulation suites that come with their own control stations and debriefing rooms. And then we have other rooms that are showing up like this that allow students to actually interact with different parts of the curriculum and the different parts of the lab. So when we have high fidelity simulations, you have a simulation specialist behind that mirrored window that's right there, while students and instructors are working with the mannequins in the care room, in the care facility. And we do have all sorts of additional tools that we use, such as fake blood and moulage, which is a fancy word for makeup that makes it look like the people and the mannequins are actually what we're looking at for same presentation we would see in a hospital site. So there's Lucina again, and you'll see that the students are actually palpating the infant and the fetus to see where they are. We have debrief situations like this, debrief rooms like this, that have additional training areas that are attached to the sim suites. And maternal child specialists like Melissa and folks that are showing here. So you can actually get a chance to see where you're going to be working with and how things are going to work. So that's a kind of a quick overview of what the sim suites look like and the simulation center looks like that we use. That is also available, as you can see, on YouTube under the UCalgary Nursing Simulation Center logo. So if you want to see it with the real sound and the voiceover, that is there as well.
Thank you, Dave. My apologies on that.
No problem.
We have not had good luck with that video using it lately, unfortunately. Technology does not like us. And I'm just going to highlight another really exciting and important piece of our faculty here, which is the nurse practitioner-led mental health and wellness clinic. So this clinic was launched in 2020 as a response to some of the just mental health challenges that we were seeing with nursing students, faculty, and staff in response to the COVID-19 pandemic, being in the clinical settings during the pandemic. So this clinic is exclusively for students, faculty, and staff in the Faculty of Nursing. It's not a university-wide initiative. So here's a list of some of the services that they offer. So they have some short-term stabilization counseling, as well as workshops. They've got access to a lot of emotion regulation and stress management tools, drop-in hours with even just de-stress art therapy, coloring, tea, things like that. Dave, do you have anything to add?
This is a wonderful service that we saw that there was a need for a place that run by nurses for nurses, because as a nurse, we sometimes will have experiences that are hard to debrief with others that don't understand what it's like to be a nurse. And so with the nurse practitioner led clinic, we have nurses working to their full scope of practice, whether they are registered nurses, nurse practitioners. And it's very, very good support. And they offer things like Wellness Wednesdays at, from 11 to 1 in the nursing foyer in the main floor of the professional faculties building, where we just get a bunch of people together and we hang out and try to build the community to support each other.
So from there, we're going to head into Q&A in just a minute, but I wanted to start by addressing some of our frequently asked questions that come up that are just things we want to just talk about. So if you don't get into nursing, what should I do if I don't get into nursing? Should I go into another program and then transfer? So nursing has admission to year one, it's that foundational year, as well as an advanced entry route into year two. We have a lot more seats for admission into year one, a lot more. So if you don't get into nursing and nursing is the only program you want to be in, my suggestion really is upgrade your high school marks and reapply with your high school grades. The reason for that being is that students tend to do a lot better in a course the second time they take it. So upgrading your course, you're going to do a lot better. Whereas students tend to see their marks drop in university, their first year of university, they drop about 10% from what their high school average was. It's very, very normal. It's nothing to be concerned about. But when we're talking about a highly competitive program like nursing, your odds of getting in are much better by upgrading those high school grades and coming in that way versus trying to come into another program, take courses, get a high GPA, and then trying to get in. So I know it's not what you always want to hear, but it really is going to be your best bet. Now, if you want to go to medical school, is nursing the right undergraduate degree for entry into med school? I can't tell you that because I can't advise on med school. What I can tell you is that in my 7 years of advising nursing students, I have seen a lot of students get into their second, third, fourth years of the program and realize that there's no way for them to take the prerequisite courses they need for some med schools, the courses recommended to prep for the MCAT, anything like that, because you have 4 option courses in your first year, and that's it. And so from what I've observed in my time advising nursing students, it's not the cleanest pathway. Nursing and medicine work side by side, but they're really very different professions. And as a result, our program and any nursing program in Canada is structured to train students to enter the practice of registered nursing. We are a regulated profession. There are a lot of outcomes that our students need to meet. And so there's not really capacity within that program to take other courses to prepare for other professions. It's a very structured professional program. Can I take a reduced course load and spread my degree over 4 years or longer? Not really. So the program structure is very, very linear. Courses in a given term are co-requisite to one another, so they all need to be taken together. And the courses are only offered once a year. So if you take a term, something happens, you get sick, you take a medical leave, you have to take a full year off because the courses that you need next in your sequence in the program aren't going to run again for a year. So because of that, there's really no way to spread the courses out. You kind of have to take them all together as a bundle in the term. Do I need to take the Casper test? No, we do not require the Casper for admission. It won't be used in any sort of supplemental application. We don't accept Casper for admission. And do I have to take spring courses? Yes. Kind of what I said before, because the program is so structured in that linear fashion, you can't move on from one term to the next without taking it in that sequence. And those spring courses only run in the spring. So you have to take them to move on to the following fall. And with that, we're going to open the floor for questions. Carrie's going to moderate our Q&A for us. We do have Camille here to answer some admission questions, but also if you have more detailed admission questions, I encourage you to scan this little QR code here and visit the admissions website.
All right, Miss Emma, the questions are flying in. So the first one we have here is, I saw on the nursing website that I'm able to study abroad in year 1 for the spring-summer terms. Would an exchange program fulfill the requirements of the open option courses?
Yes, yes, they would. So that spring, summer after the end of year 1 is the perfect time to do a study abroad if that's something you're interested in. We don't currently have any study abroad opportunities specifically for nursing students, but you can, excuse me, absolutely fulfill some of those open option or arts option requirements through an exchange or a group study. The group studies that run in spring, summer are a really great way to fill those last couple of courses.
Okay, next one, hot topic, transfer student. So how about in case of transfer students from another university and I only want nursing? So that popped up when you were talking about going into year 2, whether you should try to get to year 2, if you should do upgrading. That's what that's related to.
Yeah, so that would really depend on the courses that you've already taken. Um, because if you're aiming to get into year 2 and you've already taken most of the required courses, or if you're coming in based on your GPA, it's a pretty nuanced question. So I would suggest reaching out to our office. We'll have the contact info up on the next slide at the end of the questions. We can kind of dive into that with you a little bit more.
Okay, next one. So for students who may wish to upgrade their high school courses, does nursing only open applications once a year every fall, or do they also open during winter and or spring semesters?
So applications are only open for the fall, which is standard for undergraduate programs at the University of Calgary. We did used to have a winter intake, but we don't have that anymore.
The next one is, who do I contact to arrange in-person meeting regarding academic advising? So I'm just gonna, this person who asked this question, I'm just gonna provide you the email address for nursing at UCalgary.ca, and Emma will provide that later on as well.
Yep, we'll have that up on the screen at the end.
And the next question is, what months are the spring semesters?
May and June. So spring is May, June, and summer is July, August.
Do you recommend filling out personal statements?
For applications, so the only personal statement we would really have would be for students applying under the equitable and inclusive admission process, the Indigenous supplemental admission process, or to the rural community routes, or Indigenous community routes. So those are pretty specific application types. Maybe Camille, can you speak just a little bit more to sort of who would qualify under EQA and if that's something students should be applying with?
Yeah, for sure. So, with that, it's tough to exactly define, the exact type of situations or um, backgrounds that would fall under EQ. I think we intentionally really try to leave it broad to give students a chance to explain, what maybe there have been circumstances in the past, like certain challenges that they've had to overcome. There's really, like, I wouldn't say don't count yourself out. It's definitely situation based. So really every individual scenario is kind of different, and we do consider every individual situation. But essentially, the EQA process gives students a chance who, if they may not be admissible through our through the regular admissions pathways. EQA is a way to talk about maybe previous experiences that they've had, challenges that they've had to overcome. Maybe they have other um, other achievements that might be worth also taking into consideration. But really, it's also about making sure that students who have had to face significant challenges and have had to overcome them have an extra opportunity to talk about that. But it's very up to every individual situation. So we consider that on an individual basis and together with the faculties. Sorry, that was a bit of a roundabout about way to explain that, but
All good.
Um,
Okay, so the next question is what makes applicants stand out during the admission process?
So admission is based entirely on GPA, with the exception of an extremely small number of seats under that equitable and inclusive admission process. Admission is based entirely on GPA. There isn't really anything else you can do to stand out, unfortunately.
We also have the Indigenous admission route. So
Yes.
that also is an opportunity to provide some additional information to might help you if needed.
If you are of Indigenous ancestry.
Yes. And then the next question. So is there a pre-health course which can boost my GPA, which can be completed before fall 2025 admission?
So no, we do not have a pre-health or pre-nursing or any sort of program like that. I know some other schools do, but we do not. So that's why we recommend upgrading your high school courses.
All right, next question. Do you need volunteer or extracurricular experience to apply for nursing as a high school student?
No, so again, admissions based entirely on your average. There's no supplemental considerations.
Okay, so this next one kind of ties into that. Hello, I had a couple of questions. What can you tell me about the supplemental application? And the second question, is the application process different for out of province? Thank you.
So we've kind of touched on that supplemental piece already. So the equitable inclusive admission process is really designed for students who whose grades may not tell their whole story. So students who may have faced some adversity during school that has impacted their grades, overcome some significant hardship, demonstrated excellence outside of academics, things like that. So it's an opportunity for students whose grades aren't their whole story to tell the rest of that story. As I mentioned, we have a very, very limited number of seats available through the EQA route. So that is kind of the only other pathway there. And then of course we have the Indigenous admissions pathway and the Indigenous supplemental admissions pathway for students of Indigenous ancestry. And then there is a personal statement component for the rural community routes. And if you're interested in those, I'd recommend attending our rural information session next week, because we'll delve into that a little more there. And
All right, next. Oh, sorry, I thought you were done.
No, sorry. And can you repeat part 2 for me, Carrie?
I already clicked, I already put it as done. I'm
Oh.
sorry. What was it?
I think I can get it. It
Okay.
said it answered.
Is the process
Well, if
different
I go
for
to
out
the
of province?
answered.
Oh, the out of province piece. Yes.
Yes, out of
Neil,
province.
can you
That's right.
speak to that?
Thanks.
yeah, so the requirements are the same. Of course, the names of each course might just vary a little bit. I will send a couple of links into the chat. So to that specific question, we do have an admissions requirements tool or widget on our website where you can enter the curriculum that you're following, and you would be able to see the exact names of the courses that apply. But otherwise, the application process is the admission requirements are the same regardless of which province you're in. Just the nomenclature might be different, and ways that we receive your transcripts might be different as well. So for instance, in Alberta, if you apply through Apply Alberta, there's a way where we can receive your transcripts from the ministry online without you having to initiate like any physical process. It's the same for BC and Saskatchewan now as well. So just little bits of differences in terms of maybe how you submit certain documents, but otherwise the requirements are really the same.
All right, well, the next question I would say is for Dave. So Dave, how are clinical placement sites chosen, and do students have input?
So clinical sites are very much driven by the course that you're in. So in the fall of the second year, we have placements that are looking with public health and with congregate living settings and dealing with aging adults in community, in long-term care, in lodge settings. So those are very easy ones to, everybody's going to get it. In other terms that you're going to have down the road, if you're in the hospital, you're in the hospital. You just depends on what unit you're on, and that depends on we work with the clinical placement team, which is a faculty member and some support people that work with me in the placement setting. And we are out trying to get as many placements as possible with as many varied answers or varied experiences as we can get for it. Where we start looking at actual preferences that you as a student would be able to give us, your preference would be in your final focus, which would happen in the third year, either during the spring, summer, or during the fall term. In that case, we negotiate with the practice sites to see if we're able to get as many or to get the spots available that people are asking for.
Great, thanks, Dave. So the next group of questions, they're all very individual. So I'll type in the answer to get you to actually reach out to our nursing or admissions, because they're very, individual questions. It's better to reach out and have that conversation. It's difficult to provide advising in this kind of forum. So I will respond to those privately. Okay, so this, I would say, Camille, is best to answer for this. What would be a safe high school admission average to have in order to get admission into nursing?
That's a tough. I think that's actually a tough question. Is there really such thing as, a safe or even an exact average to share? I mean, averages are changing constantly. But I would say I think in trends that we've seen usually and correct me if I'm wrong, but I think mostly we're looking in the high 80s to low 90s. That has kind of fluctuated a little bit every year to year. And it's hard to say that there's one safe average for admissions. Just remember it is a range because it is also based on the number of applicants that we have and what averages they're applying with among other factors that kind of change that. I wonder if maybe Emma or Dave anything to add to that.
Not really. I mean, the only thing I will say is we've changed the way our seats are distributed with this transition to the BSCN. And as a result, we've only done one admission cycle so far. And so we don't know exactly, we don't have as much historical data to draw on as we have had in the past. And so because we don't have that historical trend to look at, it's a little harder for us to say exactly where that average is likely to end up. We're building a new historical data for a new program right now. So
yeah, that's a good point. Sorry, because we're still in that early stage of this introducing our new structure for a program. So that's a great point.
yeah.
Okay, next question. So we get this question also. It's a little bit tricky. If I have already been accepted for fall 2025, what grade must I maintain to keep my conditional offer? So I think that's Camille, wouldn't you say, Emma?
I would say so.
There you go. Yeah, sorry. So for conditional offers, and essentially what that means is when students are initially applying, so applications typically open around October and would close in March if you're looking to start in fall of 2025. So when most students are applying, really the only final grades that they have available would be courses that they completed in grade 11. And at some point as they get new grades available, it maybe just be the first semester of grade 12. But conditional offer essentially means that the offer is conditional until we have seen all of the final courses that you have completed and your final grades. And normally to maintain that offer, we have to see completion of all of the required courses for admission. And then once we determine what the grade averages that is required to maintain your offer, you will be notified, and you should be within that required grade average for your program. So it's mostly just making sure you have all the required courses completed and that you're more or less within the grade average required for the program.
Okay, so the next one is, what is the last day for admission into the fall 2025 semester? And is there a chance that all spots will be full before then? So I think, yeah, go ahead, Camille.
Yeah, so our applications typically close on March 1st for starting in September 2025. So that's when you would need to have an application submitted by. And then we have other rolling deadlines for other documents as well, like your transcripts. Make sure that you keep an eye out on your UCalgary Student Center. So that's an online portal where you can see a to-do list of maybe outstanding documents and when they're due. But the last day to apply would be March 1st. And then there's deadlines for document submission after that.
All right, Dave, you're getting called into action. Does this program prepare students for employment as psych nurses?
Yes, as a registered nurse. So there is the designation of being a registered psych nurse. This is a program that's offered through one of the Edmonton institutions, McEwen, I believe, is the site, and they offer a diploma program that has a bachelor degree option as a registered psychiatric nurse. But what that's a good option. And working closely with Recovery Alberta and the new ways that the healthcare system is being restructured, that's going to be a place that's in demand. However, as a registered nurse, you can work as in the mental health and addictions realm. You end up having a little bit more scope to your practice as a registered nurse than you would as a registered psychiatric nurse.
Okay, thanks, Dave.
No problem.
All right, Emma, it's one of your favorites. It's kind of a personal one, but we get it all the time, so I figure it's best to get it done with. Can I take med school or other professional program prerequisites over the summer?
So yes and no. Yes, you can if they are offered. However, you're going to be taking spring courses already. And so you're going to have a full course, especially after your year 2, you're going to have a full course load in the spring. You won't be able to take any more courses. And the summer term has very, very few course offerings in it. So in my experience with students who are trying to get these courses in, they're not typically offered in the summer. And as a University of Calgary student, you require what's called a letter of permission to take courses from another institution while you're enrolled in our degree program. And that's pretty standard across Alberta. We will not issue a letter of permission unless the course is a requirement for your degree. So unless it's a requirement for you to move forward in your nursing degree to take a course from another institution, we're not going to issue that letter of permission. And so taking courses from another school during the summer isn't an option either. The reality is that the nursing program is very heavy. Again, you're going to be taking a full course load in the spring already, so you can't take anything more there. It's very heavy and it's very designed to meet our licensure requirements. Nursing is not a pre-med program.
Okay, we still have tons of questions, so I'm going to try to go through these a little bit quicker. So there's 4 option courses for first year nursing. Is there options for second and third year nursing? Will I be able to go on study abroad opportunities in second and third year? I think you answered some of that, Emma, already, but we'll just let you wrap that up.
Yeah, so there's no option courses in third and fourth year. You take all those options in year 1. With regards to study abroad, if you can take one in the summer that's not going to interfere with your existing nursing courses, you can. So I do know that there are a few study abroad options that are shorter. They're like 6 weeks and they're only in July and August. I know we had a nursing student do one this year. If you want to do something like that, you can, as long as it does not interfere with your nursing classes.
Okay, so next question. How do you take in AP IB credits and put them into your GPA?
So you can absolutely receive advanced credit for AP IB courses. However, they don't count towards your GPA. They're like transfer credit. So you receive credit, you can take less courses in your first year. They'll meet typically some of your option requirements, but they aren't going to impact your GPA. They're just going to meet your course requirements.
All right, the next question, I'm not sure. They're asking, what are the grade requirements? We don't really have grade requirements. It's competitive GPA, but they might be asking what the individual admission requirements. So go ahead, Camille, with that one.
Oh, sorry. So you will need at least 5 grade 12 level courses. And for nursing, those are English, mathematics, biology, chemistry, and then one other approved course or option. So I sent the link to the admission requirements widget in the chat. So you'll actually be able to enter, what province you're in, what curriculum you're following, and then see the specific names for the courses. But those are the 5 required courses for admission into nursing. So I'll just repeat that: English, mathematics, biology, chemistry or science 30, and one other approved course or option. And we do have a list of approved courses and options available on that tool. For the Alberta students, that's English 30-1, Math 30-1 or 30-2, Biology 30, Chemistry 30, or Science 30, and one other approved course or option. So that's what we would be looking for nursing. But if you want to review that at a later time, I've sent the link in the chat. And then I've added, I know since we had some questions about equitable and inclusive admissions process, I've included the link to that as well, where you can review that process.
Very good, thanks. Okay, so on the next one, it's on the course requirements to apply for nursing. Math 30-2 is listed. Do you recommend us to take 30-1 or 30-2? Honestly, you can take either one of them. We don't treat them any differently. They're just whichever mark. Some people take both, and they would use whichever mark is higher. So we actually indicate that 30-2 is preferred, and that's simply to, you don't need 30-1 to be successful in the program.
Yeah, I would just add the only thing to consider there is if you're applying to other programs or second choice programs, you might need 30-1 for those. So just something to
And then
consider
the next question, what are the acceptance ratios? So that really varies, but Emma, how would you address that
So
other
it's
than that?
kind of as I said before, we don't have a lot of historical data to go on for this program, and we have changed the way our admissions are distributed. So it's a little hard to say. I would say historically, we were getting for high school admission, we were getting about 1,500 applications for 120 seats. We have more seats than that now with the way things are distributed for high school admission, but yeah, 10-1-ish.
Yeah, probably, maybe even 12. Lately, our application numbers have gone up a little bit. So, okay. Next, do you do early admissions? How would this be calculated? When would offers be sent out for the program? Yeah, that's you.
Yeah, we do have early admissions. So as long as you apply by December 1st, you'll be considered for early admission. And what that essentially means is we can consider you based on the courses that you now have completed. So if that's grade 11, we can use that. Or if it's a combination of both grade 11 and grade 12 level courses, we can use that as well. Yeah.
Okay, these questions are not slowing down. So I'm an international student and I saw that an English waiver was needed for application. However, I will graduate my school with an English diploma. Do I still need a waiver?
Yeah, I think you're talking about English language proficiency. So that is required for all of our applicants for all of our programs at the University of Calgary. It really depends on the curriculum and whether that is accredited. So if you have completed your diploma at an accredited Canadian, American, or British curriculum school, so if that school is accredited, you may not have to present an English language test. But for instance, I guess there are schools that follow certain curriculums, but it depends on who the accrediting body is. I would definitely encourage you to reach out if you're not sure. Reach out to admissions and we can check that for you. But that's something we'll want to look into early because that is one of the first things that we look for. So if students can't demonstrate English language proficiency, unfortunately, we can't proceed with the rest of the evaluation. So that's one of the first things to definitely check out.
Okay, great, thanks. Okay. Is only Stats 205 allowed for first year? Can other stats courses be taken instead? Go ahead, Emma.
So Stat 205 is recommended, and it's the course that we have seats reserved in, but students can take other stats courses if they prefer.
Okay. Is there any way we could get a grasp or a grasp of or model examples of first year nursing schedules? Are schedules a set time of hours per day? Miss Em?
That is all over the map because in first year students do build their own schedules. So it's really hard for us to say what an example would be because everyone's are going to be different. I can tell you that the anatomy and physiology courses, which are a requirement, typically run Monday, Wednesday, Friday at 8 a.m. So that is kind of a non-negotiable. But other than that, it can really be however you choose to build it because you're taking classes all over campus and yeah.
Okay, so when do conditional offers become finalized, and do we need to do anything to finalize our offer, like paying the full tuition?
So conditional offers are usually finalized around June, July for most of them when we have the final transcripts with all of your courses and grades completed. There is going to be a tuition deposit that will be required. For most students, that would be May 1st, but it depends on when you receive your offer. So that's why it's really important to keep an eye out on your my UCalgary Student Center or the online portal where you can see the status of your application. So there will be a tuition deposit that does confirm your seat, and so there is a deadline for that you want to keep an eye out for.
Great, thanks. Okay.
Just in the interest of time, Carrie, do you mind if I jump in and just kind of address some common trends that I'm seeing in the chat?
Go right ahead.
All right. So I'm seeing several questions here from LPNs or licensed practical nurses. So I would really recommend, we will put our contact info up on the screen in just a minute, but I would really recommend that LPNs reach out to us directly for a little more detailed advising. We are not a bridging program, so you won't get specific credit for clinical or other courses taken in the LPN program, but you will receive credit depending on where you did your LPN program towards a few things. So definitely reach out to us, LPNs, for a little more one-on-one advising. Similarly, I'm seeing some international students with like previous degrees, previous post-secondary education from other countries. Really recommend you reach out to admissions. The information that's on the screen here, the QR code and the link, they're the ones who will be able to give you the best advising possible on that. EQA, I'm seeing some more questions about that. So it's still a competitive program. We have very, very, very few seats under EQA, and we do receive a lot of applications. So it's not a guarantee. It's a holistic review by a faculty committee, including your personal statement and your grades. So it is still competitive. Those are kind of, I think, the big ones we're seeing here. Lots of admissions questions. So again, check the website here that we've given. And some questions about course load. So it really is, it's a full-time study program. You can't spread it out over more than the 3.25 to 3.5 years because the courses do have to be taken as a term, co-requisite together and in sequence. So there's not really an opportunity to spread it out.
Anything else you want to address? Is one thing I would just say there's a ton of GPA questions. We don't release the competitive average. It varies by year and really depends on the applicant pool. And when you have, upwards between 1,200 to 1,500 applications, that can range. So we don't release that. We don't want people to be deterred by that because, as Emma has gone over a few times, we don't have a clear, because it's a new program in terms of how we do we only have one intake. That's changed a bit. So we don't have a clear answer for you for that.
I do see one thing about in province, out of province. So we have no differentiation on that. There's no preference given to in province students. There's no restriction on out of province students, anything like that.
The other thing we're seeing is that I'm getting quite a bit of is around conditional. So, you know, is it common for conditional offers to be revoked? Are all students who've been accepted currently conditional? Those two things. So maybe you could do a quick answer to that, Emma, just in regards to, yeah, just quickly answer those, I would say.
So, I mean, the vast majority of students who will have received offers right now are likely conditional if they're still in high school. But if a student has applied who has graduated from high school and isn't upgrading, taking a gap year, something like that, they could receive a finalized offer early because there's no coursework outstanding. There's no conditions to put on them. But the vast majority are going to be conditional right now, just based on the fact that students are still taking classes. And what was that second part? Sorry, Carrie.
How common is it for conditional offers to be revoked?
I would say it's not overly common. As I said, I've been advising nursing students for about 7 years, and I see a few some years we actually really don't see any. So it just depends. It's students just have to really maintain whatever our lowest admitting average ends up being when those final grades come through, and of course make sure you don't like drop bio 30 and then you don't have the course, because you do need that. But it's not common. As long as you're maintaining that minimum average, you're making sure you have all your courses, the vast majority of students do not see an offer revoked.
Right. Okay, there's a different question here, so I think it's important to ask. What are the scholarship deadlines?
Yeah.
Camille, can you speak to that?
Yeah, for sure. So we do have 3 types of awards or scholarships at the University of Calgary. So first one is our automatic awards. Those ones are largely based on your admission average, and you don't have to apply for it. So it's an automatic award. So there's no deadline. We'll consider people throughout the cycle. And then the second category is what we call our high school entrance awards. So these are largely based on they're not academic based, so it could be based on a variety of factors, including financial need, maybe extracurricular activities, or community involvement, for instance. But there's over 200 different awards under this one category, and that one has a deadline of March 1st, so the same day that the application is due. And then the one I do want to highlight is our prestige awards. That's the third category. These are our highest value in terms of amount for awards. That has a December 1st deadline. And so for the prestige awards, we're largely looking at a combination of your admission average, so your grades, as well as an essay that will be required for the application. So December 1st is a deadline for prestige awards, March 1st for high school entrance awards.
Great. Okay, so it's 8:01 now, so we're gonna have to wrap up. So the only thing I'd say, if you can just comment on where people who attended will get a copy of the recording, that would be great.
Yeah, actually, this will be posted on our Choose UCalgary YouTube channel. And then it's also accessible on University of Calgary Future Students Facebook page. I'm not exactly sure if everyone will get an emailed copy, but it will be publicly available on those platforms.
Okay, and I apologize if we didn't get to all your questions, but please contact, I put it in the chat here. If we didn't get to your, I'll put it in the chat. If we didn't get to your question, please email nursing@ucalgary.ca.
Which is also the email up on the screen. And if you scan this QR code, it will take you to the contact info for the undergraduate and graduate programs office in the Faculty of Nursing. If you have any questions, please feel free to reach out to us. And if we can't answer it, if it's an admission specific question or something like that, we will send you in the right direction to get answers to your questions. But we are, absolutely available to answer more questions if we didn't get to yours, or if you think of something later.
Thank you all very much for joining us.
Thanks, everyone.
Yeah.